Good afternoon. Nice to be with you again this afternoon. We have a lot of information to go over, given where we are with cases and just the environment in California. So we're excited to dig right in. So the map of the United States. I think many of you have been watching it either on your nightly news or in the newspapers or on the web, and you see that many states in California are experiencing high increases in case rates. The governor talked yesterday about test positivity in parts of the country that go as high as 25, 30% test positivity, largely in states where they're often testing the most symptomatic or only symptomatic individuals, unlike in California, where we do a great deal of testing of those who are either asymptomatic, pre-symptomatic, or not infected at all. So we see that the Midwest experiencing quite a significant increase in cases, but really states right next door to us where they've experienced surge. California, as you've been tracking over the past couple of days, we ourselves have seen increase in cases as well in many parts of our state, something that we're closely watching. And in the backdrop of our tier assignments today really gives that context. I like to think of it as the sort of level of COVID transmission is generally higher in this environment than we've seen over the past many weeks. So what are we seeing in terms of case numbers today? 5,367 reported cases today. I'll remind you that our Tuesday reporting number is really looking at a 24-hour period from Sunday morning to Monday morning. We work through, validate those cases over Monday afternoon into the evening, and then report them today, Tuesday. So this reflects Sunday data that is often lower in terms of the number and reported. You saw in the previous couple of days where we've had case numbers over 7,000 statewide. Altogether, that's why we look at the 7-day average. Over 6,000 cases is our 7-day average. Total test and test positivity, we've seen an increase in test numbers, 176,000, over 176,000 tests done. And then our 14-day test positivity is 3.7%. I'll tell you, we also track the 7-day test positivity, which is 4.2%. We hadn't seen test positivities above 4 since the end of August, early September, just in terms of context of where we are. So 14-day test positivity, 2.9 back in October. Today, just 2 weeks later, 3.7. Similarly, we talk about hospitalizations and ICU numbers. I'll just also remind you or tell you for the first time, some of you, the trend that we've seen as we continue to learn about COVID transmission is when we identify cases today, we expect to see some of those cases, approximately 12% of the cases, end up being hospitalized 14 days later. So between 14 and 21 days later. So today's cases become hospitalizations 2 to 3 weeks out. And so it's important as you look at today's hospital numbers of 3,083, which represent 31.6% increase over the past 14 days. These really higher number of cases that we've seen over the next few days won't manifest or won't become patients in hospitals for another 2 to 3 weeks. Similarly, we know that the ICU hospitalizations have increased, currently at 859. That's nearly a 30% increase over the last 14 days. And we know that patients hospitalized today with COVID, if they need ICU level care, often need that within the first 7 days of hospitalization. So as we see that hospital number creep up because of the case number that's gone up, we also know that we'll see an increase in ICU hospitalizations. So we have spent quite a bit of time speaking about all of the things that we should do to reduce our risk. We wanted to take a moment to discuss what are the higher risk or high risk situations. So one thing we know that activities where it's difficult to mask the whole time, so for example, eating and drinking, create a higher risk for COVID transmission. Similarly, activities where you see people who you haven't seen recently, so people outside of your household, also create a higher risk situation. And I'll just say, we often feel this the most with people who we're close to, so extended family, our closest friends. But even if we haven't seen them for a while, just because they're close to us personally doesn't mean that they have a lower risk of either passing COVID on to you or having COVID come from you to them. So we want to be very careful, not just with those we don't know from outside of our household, but even those that we know quite well who aren't part of our immediate household. We also know that activities where it's difficult to keep your distance create a higher risk. So imagine multiple people at a small table, either playing a board game or having and sharing a meal. Activities of longer duration, we also know create a higher risk. And activities that don't allow, in spaces that don't allow plenty of fresh air to circulate, also create a higher risk situation. We've talked to you for many, many months about the importance of outdoors versus indoors. This is really one of the manifestations of this point, but also the ability, even when indoors, to have the windows open, the doors open, to make sure that as much fresh air from outside is circulating inside, an important feature of reducing risk as well. So instead of just showing you all the things that we advise in terms of reducing risk, we wanted to show you exactly what those features of activities look like that increase risk of COVID transmission. So this is a curve that I'm going to walk you through. We're going to use this more and more in the future, and I'll explain why in a moment. But the point of this is to show you exactly how some of the points made in the previous slide actually manifest in case transmission across California. So this is California's epidemiologic curve. And what we mean by that, it's sort of the scientific way to say how we allocate various cases. And what this shows, each blue bar and the height of the blue bar shows a certain number of cases that are attributed to a specific day. So this isn't the day that the test result came into the state. It's not even sometimes the day that this test was processed or the test was collected. It's actually the day that we believe is the day that that person who tested positive had their first set of symptoms or indications that they were exposed and positive with COVID. So when you look at this curve, you'll see early on the left side, those early March, mid-March and early April days, after we did the first red line that you see going vertically, is when we did, as the state, the first state in the nation to do a stay-at-home order. And we see what was a orange curve, yellow curve that was going upwards begin to flatten. That's our first effort to really flatten the curve. And we did a pretty tremendous job over those first many months of our response to COVID. And then the second vertical line shows when we, after seeing some increase in our openings, an increase in mixing and increase in cases, when we did statewide our our statewide masking order, which really advised all of our citizens to wear a mask in many, many of the settings outside of their household. And at that point, you see over the next few weeks that we begin to, even though it's pretty steep, that rate of rise starts to reduce, and we start to see us working towards the peak of our first real surge in cases in California. The last red vertical line right around the middle of July shows when we'd seen such high levels of cases that we put more of our sectors that were open indoors, and we required them to close to indoor activities and move them outdoors. So restaurants, some bars in some regions were moved outdoors, others were in other regions, they were closed down outright. So we start to see this move between moving things outdoors, reducing the number of activities where you can't stay masked throughout the entirety of the activity, that those changes were the ones, along with that statewide masking order, were the actions that helped us bring down the curve from those high peaks in the middle of July and begin to move into the really flattened curve that we enjoyed over the last many weeks. You'll see at the very far right, that yellow shaded portion, that the blue bars are starting to increase again, and we're starting to see a number of counties and statewide just an increase in the number of cases. And that is what we are concerned about. That is why we are watching things very closely. And that is why today's announcement, when Dr. Pan announces the tiers, you'll see a number of counties moving from towards a more restrictive tier as we expected and anticipated even last week. So again, this is a reminder we have done a lot together. Over the last 8 months, many individuals across our state did tremendous things to decrease transmission. Many of us wore our face coverings. We've limited our mixing. We've avoided crowds. We've continued to practice those important things like hand hygiene. We've stayed physically distanced. And many of us, when able, have stayed home when we're sick. We know that this is hard. We know many people feel exhausted, they feel isolated, and they're impatient. We talked last week quite a bit about COVID fatigue. I even talk about COVID resentment. We know that this is hard work, but we must do more. Yesterday's hopeful news about effectiveness of vaccines and what we hope months down the road will be another tool that helps us get through COVID and through this pandemic is indeed good news. But we know right now we must do more. The virus is not over just because we're tired of it. It doesn't itself put its guard down. It looks for opportunities to spread. And many of those activities that we highlighted as higher risk are exactly the opportunities for spread that we want to be laser focused on. Invite all of you to be our partners once again in trying to reduce risk so we reduce transmission, flatten the curve again, and make sure we can soon enjoy many of the things that we've missed for the last many months. So with that, I want to invite Dr. Pan up to talk about our tier assignments for the week, and then I'll be right back with you to take any questions.
Good afternoon. Thank you very much. So as mentioned, it's my turn to talk to you today about where we are with our blueprint for California. So as you've seen every week with this structure, we have this blueprint that we had unveiled that outlines the criteria for loosening and tightening restrictions on activities based on the levels of disease transmission that we are seeing, both at the county level and statewide. And as I can remind you, every county is assigned to a tier based on test positivity, adjusted case rate, and our health equity metric. Oops. Let's see, this is a slide here. There we go. Okay, so as you are also likely very familiar with, your county color determines what operations you can do in your county. So just to highlight again, we have the widespread or purple tier, and that's when you have adjusted case rates over 7 and a positivity rate over 8%. You have our red substantial rates and case rates 4 to 7, positivity rates of 5 to 8%, and then the health equity quartile needs to have test positivity rates between 5.3 to 8.0%. And again, we have a moderate range of the orange, 1.0 to 3.9 case rates with the positivity rates 2.0 to 4.9. And again, our health equity quartile needs to be at 2.2 to 5.2%. And then minimal disease transmission in our yellow is less than 1.0 of case rates and less than 2.0% of test positivity. So what we want to show you here it's actually very interesting to think about that epidemic curve that Dr. Ghaly showed you and what's happening in our state. And this again really shows us how we have moved as a state with the changes in disease transmission. So we started out and we launched this blueprint for a safer economy at the end of August. And we started out with a really large proportion of our state in the purple tier and the widespread tier. And you can see as we progressed every week that we've opened more and more and progressed more and more counties towards the right, towards the minimal. We look at October 27th, the week of that week, and it looks there like that was probably where we were the most open. We had the least number of counties in the widespread tier that has the most restrictions, and more counties were on sort of the other side of this, and the most counties in the yellow or minimal tier. Just as you saw in that epidemic curve, what was happening around the same time was that we started seeing some slow increases, probably the beginning of October. So as we've seen reopening, which is anticipated, we've started to see more cases and more concerns about increasing community transmission. In addition to our reopening, you've seen as that map that you saw earlier as well of the whole country, and we are side by side with other states and other parts of the country that are having increasing cases as well. So over the last several weeks, you've seen actually that we have had a few more counties come into the widespread tier in the purple. And we're going to tell you which counties today have moved into the different tiers and moved backwards. So today there are 3 counties, Sacramento, San Diego, and Stanislaus County, that are moving back to purple in the widespread tier. There are several counties moving back to the red or substantial transmission tier: Amador, Contra Costa, El Dorado, Placer, and Santa Cruz. And there are also counties moving back to the orange tier: Modoc, Siskiyou, and Trinity. And again, with these increases, we are not seeing any counties move forward this week. So to remind you, and as Dr. Ghaly mentioned as well, all of your simple acts can make a huge difference for COVID-19, and it will help us prevent the flu as well as we head into the usual flu season. We really implore all of you, wear a mask and maintain 6 feet of distance from others. It's always really important to wash your hands and have good hand hygiene, especially before you're eating. And you again heard all the things that can be high risk, so it's really important to have hand hygiene. That is actually much more important than cleaning surfaces and other things like that. It is much more important to be cleaning your hands, washing your hands before you're touching your face or before eating. And really, really important, as hard as it's been, as Dr. Ghaly emphasized, is minimize mixing. It is really safest to stay with the people in your own household and minimize mixing with other people. And really important to get your flu shot. I have gotten mine. I've made sure everyone that I love has gotten theirs. Please, please get your flu shot and help protect all of us from flu this season as well. Thank you.
Thank you, Dr. Pom. I want to start by taking the first reporter question.
Ron Lynn, Los Angeles Times.
Hey, Dr. Ghaly, thanks again for taking our questions. They're super, super helpful in helping us communicate what's going on.
Great, my pleasure.
Several questions for you. On Monday, health officials in LA and Santa Clara counties said they're now in what they consider a surge. Would you consider California overall being in a new surge or a new wave? Are the main drivers of this surge really small social gatherings and not other things like workplaces? And if it is gatherings, how will you convince Californians to not gather during the winter holidays, given I've heard from a lot of people, some people really, really want to make this one exception because they feel like it's a long, difficult year. And finally, do you think we'll have to go into more stringent closures than what's currently allowed in the purple tier, or do you think the purple tier is really good enough in terms of dealing with a surge in cases? Thanks so much.
Yeah, no, thank you for your question. Exactly to your point, we answer, and I enjoy taking time with each of you so we can communicate to the broad public a clear message, a consistent message, and a relatable message, so that Californians feel like they're empowered and equipped with the tools they need to make good decisions and reduce risk. To your question about surge, I think a number of counties are indeed experiencing quite high levels of cases, not necessarily the highest they've ever seen, but certainly compared to the lows we've been experiencing over the past couple months and that downward trajectory, we are certainly seeing almost all across the state an upward trajectory. And so those things that gives us concern. Is California in a surge? Hard to say, unclear what the exact definition of that is, but clear that we are seeing increased cases. And as Dr. Pond just outlined, first week since we started moving counties forward to less restrictive tiers, that we've had no county move to a less restrictive tier. Only a number of counties moving back. And just to reiterate what Dr. Pond was indicating, as we look forward to next week and we see which counties may have missed their current tier threshold this week, we anticipate if things stay the way they are, that between this week and next week, over half of California counties will have moved into a more restrictive tier. And so that certainly is an indication that we're concerned and that that we have to keep a close watch on what's happening, not just because the cases matter. We often use case finding in order to be able to identify where transmission is happening and to bring to bear those tools of contact tracing, disease investigation, and isolation in order to reduce transmission. To the other parts of your question, certainly we constantly look and determine whether our tools and our framework make sense. As the governor indicated yesterday, we feel that the blueprint is working, that exactly at the time we're seeing increases in cases statewide, we are beginning to see counties move to a more restrictive tier. We talk about not just loosening restrictions through the blueprint, but when needed, tightening. So we believe California has a framework that is going to help us get through the next many months, but we evaluate it constantly. A number of counties asked us to look at their data, to take into account certain conditions in their county as we think through that, but certainly because there's generally more transmission, more community transmission, we are certainly quicker to work with our counties to make sure that we don't miss a beat. And if a county does need to go into a more restrictive tier, we do that in a timely way to make sure transmission doesn't get away from us. And we've seen it before where little bits of transmission increases end up resulting into quite radical and what some people call exponential or high rates of rise transmission, which is exactly what we want to avoid statewide.
Julie Watts, CBS 13.
Thanks so much for taking our question, Doctor. Actually, if you will, we have two questions. The first is regarding youth sports. Thousands of youth sports athletes are traveling out of state every weekend just to compete against other local teams because California is one of the last remaining states where competition is still not allowed. So 3 weeks ago, you said that updated guidance was coming. We have been overwhelmed with emails from parents and coaches who are desperate for answers. So doctor, can you tell us today, when will they get those answers? And actually, from a public health perspective, are you more concerned about kids getting COVID on the field locally or contracting it while traveling to states with higher COVID rates and then bringing it back here? And then one more regarding the Perkin-Elmer lab. Dr. Ghaly, CBS 13 has uncovered a surprisingly high number of inconclusive test results coming out of the state's new lab in its first week. Have you identified a problem or a solution yet?
Sure. So thank you for all the questions. So look, I'm a father of 4. My kids are also desperate to find out when they might return, not just to practice and conditioning, but competition as well. So I join the ranks of parents who are concerned and want to see California guided by science and data, but also finding a way for our young people to have that important outlet, that important expression of activity. So I share share with many parents, and I know a number of people on our team do as well. So I say that to begin. We are, and I said it before, close. These are not easy guidances to put together. There's not just the competition issue, but there's the conditioning issue. There's understanding how we continue to drive through our equity lens to make sure that there's important broad access to all of these opportunities. And I will say it to people who are close friends of mine, others around the state. I hope that we find a way to hold on a little longer, that we understand that moving into states and other areas with higher transmission is risky, not just for that team, but for the community that they return to. So to answer the second part of your question, or the second question you had, absolutely, we want to find ways to discourage people from traveling long distances to play other teams, play local teams, because it's allowed there. We know that these are difficult times. We are working to make sure that we have solutions that are appropriate for a state the size of California, not just from the geography, but from the population size as well. So soon, but not quite today, that guidance will be out. And I, like you, have heard from hundreds, even close to thousands of parents and concerned coaches as well. So we are certainly interested in getting this out soon. With regards to PerkinElmer, a new lab often goes through some important validation periods. We did identify that a number, even a higher number than expected, of tests in the first week came back inconclusive. We have been working closely with the PerkinElmer team, with our lab directors, with the staff, to ensure that we have identified the reason for that and corrected it. We believe that we have. Not only time will tell, but we're continuing to watch closely those results. To get into the weeds a little bit, certainly one of the validation steps that confirms that the necessary sort of chemical reaction to run the test didn't occur for some of those inconclusive tests. We've identified some of the issues with why they didn't occur and have since corrected it. So we feel like we're on the road to having fewer inconclusive tests, so that the lab can do what it was meant to do, which was provide timely information about someone's COVID status to equip public health departments and other entities to track the transmission of disease. And I would say that if you're one of those individuals from the PerkinElmer lab in Valencia, or any lab that receives an inconclusive test, if you were tested because you were concerned about your symptoms or your exposures, please get retested if you have an inconclusive result. We will, through our own efforts, try to expedite the result so we can give you more timely information. And until you get that result, you should take appropriate precautions to protect yourself, protect those around you, and make sure we don't have additional transmission as we wait for that result.
Melanie Woodrow, ABC 7 News.
Thank you very much for taking the question, Dr. Ghaly. Appointments for essential workers at the SF testing sites appear to be booked out for the next couple of weeks. I reached out to the COVID Command Center about that, and they are telling ABC 7 News that the appointments are being prioritized specifically for essential workers who have symptoms or have had a known exposure. We know that a lot of people might be asymptomatic or uncertain whether or not they've been exposed to somebody with COVID-19. And for those who are traveling to the upcoming Thanksgiving holiday, even though that is not highly recommended, what should those individuals do if they cannot find a test site to go get tested?
Yeah, I mean, these are great questions. We agree that prioritization should be for individuals who are symptomatic and concerned with a significant close exposure. That said, we have worked hard county by county and statewide, and the exact reason we brought on a large new state lab with the goal of reaching 150,000 new COVID tests a day was so that in the times when we're seeing cases increase, when we have more people who are experiencing symptoms or had close exposures, that we can continue not just to test those individuals, but continue to test people broadly across our communities. That helps us not just from a surveillance perspective, but it gives us confidence we're finding those asymptomatic or pre-symptomatic cases and have the chance to reduce transmission through the additional contact tracing and isolation protocols. So it's a vital strategy for California. We talk about case finding. We are serious about that. We want to find the cases, not just the more obvious people who have symptoms and are likely closely exposed. Identifying those individuals is, of course, important and useful, but equally important is finding those people who may not know they're positive so that we can help wrap around them and ensure they're supported to reduce transmission. So my hope is not just the site that you mentioned, but all sites in California can continue to allow all comers to get tested. We will work with county by county to make sure that that does occur, especially as we continue to support schools and other essential areas of our communities to not just stay open, but open anew. And in terms of the question about those who might be traveling and their inability to get a COVID test before traveling, as I've told many people many times, that practicing the important steps that we've talked about, wearing your mask at all times when you're with people that you aren't with normally, not in your household, keeping that physical distance, washing your hands, as Dr. Pan reminded us, is a very important piece, spending times outdoors, minimizing our interactions. All of those things are important to reduce our risk of transmission. So if you aren't able to get a test, and even if you are, right, the potential false comfort in a negative test one day just to find out that you really were positive the next if you were retested. It's the most important guidance to continue to follow these simple acts that can not just help us keep ourselves safe, but extended family and others that we may see during the holidays.
Dan Obano, Southern California News Group.
Thank you, Doctor, and thanks for the update on youth sports. I wanted to follow up with that, and I was wondering if you could please address high school sports that have also been under the guidelines of the CDPH since August 3rd about limiting to conditioning and skill work. Those high school athletes are, statewide are approaching their CIF competitions as early as mid-December. What would your message be to, high school athletes, coaches, families that are wondering if they're going to be able to play their high school athletic competitions during this coming school year? And do you think a county's standing, tier standing would dictate, what they're allowed to do as far as competition? Thank you.
Yeah, so thank you for the question, really a thoughtful question. And I would say, it has certainly been among the many challenges that we've had in managing the pandemic for our state is ensuring that young people, high school and even younger athletes have a chance to continue to practice, continue to improve their skills, and the lack of competition we know and have been hearing the concerns about. We are working closely with CIF and others, other youth sports leaders, interscholastic sports leaders, to ensure that we are aligned in the guidance. It will provide clarity as to when competition can take place. And to your point about it being driven or guided by our current tiering, of course, with lower degrees of transmission, either generally across the state or in specific regions or counties in the state, there is tolerance for additional even some of the higher risk sports to occur, not just from the conditioning, but from the competition perspective. And when we're seeing high rates of transmission or counties that have been, in the purple and even red tiers longest, that they may not have as many of the higher risk sports return right away. But all of this will be released soon, working through some of those final details, and hope to get that out with a great degree of clarity in the near term.
Mike Duffy, ABC 10.
Dr. Ghaly, a lot of people have said that economic health should be considered when we talk about public health. Have you considered something like this as a metric? And what would you say to the business owners who are worried about once again having to shut down?
Yeah, and we often, from public health, we think about it not just as health in the strict sense or COVID health. We do think about it very broadly. And a number of us believe and see evidence that working to control the transmission of COVID, making sure that it doesn't have the horrific impact in California that we've seen in other parts of the nation and other parts of the globe, is protecting not just our public health in the narrow sense, but our broad sense of public health, which includes our economic health. And I think I really appreciate your question, because one of the things we have all in public health been talking about, when we look at our response early in the pandemic, the message was very much about stay at home. We're going to give guidance. Please follow the guidance. We know as COVID fatigue sets in, people have even COVID resentment, that our messaging needs to shift. We need to be more relatable. We need to spend more time making the connection between our own personal actions, our decisions within our households, how those decisions actually can guide the fate of where our businesses are in our tiering system. And that collectively, if we do those simple things and we do them well, that many of the businesses that are at risk of returning to lower levels of occupancy or closure may have a chance to stay open. So we want to continue to work with all Californians, including our business owners and our small and large businesses across the state, to ensure that together we act, do these simple things, keep as much of our economy going while we ensure that transmission rates are lower.
Tom Thompson, AP.
Good afternoon. So many of the Bay, well, I guess all the Bay Area counties, San Francisco Bay Area, are recommending 2-week quarantine for anyone who travels outside the region, and they're now considering a similar recommendation for those that come to the region from states with high case numbers. Do you think these are good ideas? And if they are, why not require it rather than simply recommend it? And might the state consider something similar statewide?
So as we reflect, we work very closely with all the local public health officers. The Bay Area public health officers are in regular, frequent communication with us. None of these are surprising or of concern to the state. We certainly believe that actions that help reduce transmission, especially as increase out of state and even between counties in distant part of the state occurs, that advisories to do that safer, lower risk, lower exposure after those activities is important. To your point about requiring versus advising, certainly these are decisions that need to take a number of factors into account, but also a recognition that in order for us to get through the pandemic, working together, delivering relatable, understandable, clear messages, and working with Californians to show why making the choice to do a quarantine after travel, or for people who've come to visit from other higher transmission states, that those are advisable things and actually play an important role for our statewide effort to reduce transmission. And indeed, at the state level, we take a number of factors into play to determine what it is that the state should do statewide. And certainly, we are considering the guidance and advice around travel, especially as we enter this period of holidays and other events and activities where travel is common.
Haley Winslow, Fox 11.
Hey, Dr. Ghaly, thank you very much. Can you please take a picture of what Thanksgiving should look like for people this year?
Yeah, go ahead. I didn't mean to cut off your question.
I don't know, just kind of like at the dinner table, you know, when people are trying to make plans for Thanksgiving. I like we talked about, I think people have kind of a false sense of security that if they haven't gotten it by now, you know, they're not going to. And having Thanksgiving with family wouldn't be that bad.
Yeah, I think really excellent question. And I'm going to say a bit stay tuned. Later this week, we'll be coming again together to talk exactly about this issue. But in advance, I think it is important to say just because you haven't been infected or you knew you were infected at this point doesn't mean that you're protected or safe, right? Our actions on a day-to-day can really change our own risk profile for being infected by COVID. The slide that I showed earlier showing what high-risk activities look like, I think are exactly some of the points that I'll reemphasize. Activities that end up being close number of people in small spaces where you can't easily keep your mask on the entire time, that are long in duration, that include people within your household, but from beyond your household that you haven't seen in quite some time, and where air circulation from outdoor air is not great or even good. All of those conditions, which you can imagine could be a meal at a dinner table with people you haven't seen in many months over many hours, where people maybe start wearing their mask and take it off. You can imagine some of those situations being not just high risk, but really high risk. And the concern for that is real. And we do advise as much as possible that people make plans and make choices that reduce those types of activities as much as possible to manage our risk. We know we're entering a period where people not just are bringing their guard down, but they desperately want to bring their guard down. They're eager to see people and do things that they miss doing. And we certainly know that Thanksgiving this year is going to look different than Thanksgiving last year. But for us to get to the things we miss and love, we do have to make these hard choices. We do have to make these sacrifices. And we hope to be your partners in making those choices along the way.
Brody Levesque, LA Blade.
Good afternoon, Dr. Ghaly. Dr. Anthony Fauci, the nation's top disease infectious expert, just announced that if the Pfizer vaccine is readily available, he will be taking it. I have a couple-part question here because this has been a controversy and it's ongoing in certain parts of California. First of all, let's talk about the vaccine. We're being told by the incoming administration and other people that we're looking at probably next spring. Have you and Governor Newsom discussed plans for distribution of the vaccine at the point it's available? My understanding from speaking to the Vice President elect and the other members of the transition team that they're aiming at probably our first responders in California and, of course, our much critical healthcare workers, and then we'll go into our high-risk people such as nursing homes, people of that regard. And then the second part of the question is, looking at the numbers of the 65% jump in the last 2 weeks, what other preparations is your office taking since it's really getting out of control? So that was my two questions.
Sure. So on vaccines, look, there's a lot of different news about where we are with the vaccine. I think we anticipate that there are that we're getting near approval of some vaccines. That does not mean that we know how much of the vaccine will be available nationwide, how much of that will come to California. I will remind you, as the governor has noted over the past few weeks, that our vaccine planning process is robust in California. Since April, we have had work groups and internal meetings around preparing for the vaccine. Over the past many weeks, we have made more public demonstrations around our preparedness. We have built a California Scientific Safety Advisory Committee that is tasked with confirming much of the data and the level of transparency and the safety of vaccines that come across through the FDA as available. We've built a team of ethicists and other experts, including geriatricians and individuals who understand different challenges with prioritization of scarce healthcare resources, to create a plan so that California, with equity in our forefront, can provide vaccines when available to those who would need it the most, benefit the most. And then when we have more vaccine, who the next priority groups will be. And then when we have widely available vaccine, how we get it distributed to all Californians. So that is certainly what we continue to work on. I'm always pleased to hear a trusted, thoughtful science-first person like Dr. Fauci give his opinions. It informs and guides us as well. So we look forward to more engagement with Dr. Fauci. I have some regular engagement there, and we do look forward to that moving forward on the vaccine and the total global response. In your question about the level of surge, I think that's what we've been indicating for weeks. We are concerned about this high level of increased cases, whether you call it a surge or another term of art to describe it. We are certainly working to ensure that those transmission rates begin to come down. And that's exactly why on this Tuesday and each Tuesday, we discuss the tiers. And before we announce county assignments, we remind you that the blueprint is not just a strategy for thoughtfully slow, stringent loosening, but also for the tightening of some of our restrictions when we see exactly what we're seeing now.
Spencer Custodio, voice of OC.
Hi, Dr. Ghaly. Thanks for taking our questions. I'm just trying to figure out what some of the primary drivers. I know yesterday you had mentioned some social gatherings, at private households might be contributing to the increased spread. But I've been wondering if, any of the contact tracing and efforts and the data there has shown, maybe some restaurants or bars that are open in certain counties. I think, if you're orange tier, supposed to be outdoor. But if any of those kind of establishments are also helping drive some of the increase in cases, and, how might some of the guidelines could potentially change, maybe allowing less people indoors in restaurants, encouraging more outdoor activities as much as you can during the winter months?
Yeah, very thoughtful question, Spencer. Thank you for it again. And as I mentioned yesterday, because of the contact tracing information, because of the outbreak investigations, because of our thoughtful engagement with people when they're getting tested to ask what their experiences have been, we do have information. It can always be improved. We work hard to make it more robust, but it does point towards certain activities. And each county is different. I'm impressed by how in some counties, one of the leading areas of transmission are, as you pointed out, indoor dining. In other places, it turns out to be something different. Let's say some outbreaks in places of worship. Consistently, we hear across all of the counties concern around private gatherings. Some people call them backyard barbecues. Some people call them household gatherings. Certainly many of the attributes of the higher risk activities that I outlined earlier go into play for why household gatherings, private gatherings are higher risk. We tend to take our guard down. We think it's safe because we know the people. Even though we haven't seen them in some time, they're longer activities. Even when we start outdoors, we move part of it indoors. Those sort of actions we know increase risk. So we shine a bright light on those activities because when we put out the clear guidance, sector by sector, business by business, those apply in one place. But our actions, our personal responsibility is also very key. We will continue to dig into those data, work with our local public health partners, dig in deeper to the contact tracing information that we have greater and greater every week. So we ensure that with better precision, we find those areas where transmission is occurring and ensure when necessary, we do limit occupancy if that's indeed going to help us reduce transmission or really encourage and even create an environment where activities move from indoors to outdoors. All of that becomes a little tougher during the cold winter months, but still, we are going to work together through this, and we will take the necessary actions as we see the data and science point us towards those actions.
Lori Weisberg, San Diego Union Tribune.
Hi, thanks for taking my question. I have, well, it's kind of a two-part question. First, I'm wondering, are you talking, obviously I'm talking about San Diego County, but are you talking to county officials who are trying to see if there's any way to avoid the restrictions of the purple tier, anything they can do other than ramping up their testing to sidestep what will be basically this third shutdown of indoor service for restaurants and bars and gyms? And second, are you worried about the unintended consequence of with this pandemic fatigue and businesses who feel they've done all the right things, saying, you know what, I'm going to take my shot, my chances, and I'm going to just stay open for indoor business if people want to come inside? Are you worried that you're going to see, and then maybe there's not the resources to enforce that? Are you worried about that starting to happen little by little with what you acknowledge as pandemic fatigue for both businesses and patrons?
Yeah, so on the narrow San Diego question, of course, with every county, especially counties that are increasing spikes, we're always in close dialogue. I myself talk to many counties every day, whether it's their public health leaders, their elected leaders, answering questions, hearing perspectives, hearing viewpoints, and trying to relate and express our level of concern. But it also always comes with a hand of support, a hand of interest in trying to figure out what is the next thing we can do, what is the current state of affairs, and that goes for San Diego as well. I commend the leadership there, up and down from their board to the number of people in their public health department and throughout the county who are really going through tremendous efforts to not just keep things open, but first and foremost, to pay attention to transmission, to recognize that this is a serious and deadly situation for many, and that we want to do what we can to reduce transmission. To your point about sort of the fatigue and businesses and patrons saying, well, I'm going to take the risk, we're tired of going back and forth. I mean, this is exactly why over the last few weeks, we really have felt a strong desire and need to transition our messaging, our communication to one where it isn't just about guidelines and restrictions, but it's about partnership with every Californian, figuring out what we can do to reduce our own risk levels, to make sure that we're doing what we can to reduce transmission so that those efforts can manifest in lower data and actually keep our businesses open. So I implore all Californians to sort of look in the mirror, ask what you can do differently. How much more can you keep your mask on? How much more can you work with your own communities, your own family members to plan events in a lower risk way? Each of those efforts makes a difference. We know that it does. We've seen it in our data for months, and it's together we can make that difference and be committed to it. So whether you're a business owner or a patron, I think there is more that we can do. And when we do it, and we do it together, we do see the rates come down. We've seen it before. We will see it again.
Anna Berry Jester, Kaiser Health News.
Good afternoon. Thank you so much, Dr. Ghaly, for taking our questions. piggybacking off of your points about the drivers of infection, if personal and close contacts and household transmission are such a big driver, I wonder if there are additional mechanisms beyond the tiers with the opening and closing of businesses that the state is considering. You just mentioned a change in messaging. I wonder if there are other levers, though, like providing more resources to help people quarantine or isolate, changing or updating the paid sick leave rules that you put in place that might help as well.
Yeah, so we do. We think about all of those things, and we agree that those are some very important aspects of things that counties can prioritize. The state has provided quite a few resources already to support that, and we're always looking for either improved messaging or additional services and support. We know that a number of people who where it's really difficult to isolate for the entire period or for an entire day, just based on who's in the household, the responsibility as a breadwinner or a primary caretaker, that these things are difficult. And we are certainly working county by county to identify those resources, those messages, those practices that might help us do better, even if not perfect, but better at reducing transmission. We know things, it's not popular to say, well, if you're symptomatic or sick, or if you've tested positive, but you don't have significant illness, that wearing a surgical mask in the house around people you love, it's uncomfortable for many people. They wonder why they're doing it, but it's exactly the kind of thing that can help make a important, even if incremental, reduction in transmission risks. As it relates to sick leave policies, we're constantly watching the clock, we're constantly watching the impact, and among others in state government, we are always looking to see where we are with our federal partners in terms of providing resources so those important programs can be extended, and that the need to put food on your table, to make your rent, and those important, reasonable pressures that all of us face aren't the things that always get in the way of us being able to take care of our own health, the health of our families, and the health of our communities.
Final question, Sophia Bolog, the Sacramento Bee.
Hi, Dr. Ghaly. You talked before about how California's vaccine safety group won't delay a vaccine from reaching California, and you said that our experts basically are going to be able to review some of the publicly available data from these clinical trials, so their review can take place at the same time federal regulators are assessing, the efficacy and safety of these vaccines. So I'm wondering, now that Pfizer has released some of its efficacy and safety data, I'd like to hear from you how that review is actually going in California. Have the experts on our panel started reviewing that data? And is there enough evidence at this point that they're able to draw any conclusions about it?
Yeah, no, so excellent question. And the Scientific Safety Advisory Group is active. They have already begun meeting. I don't yet have the recommendation or assessment on any of the publicly available information that I know that they will begin to review. So more on that later, but certainly we have built it so we don't create any delays on making that final determination, that these are individuals with long experience in reviewing this sort of data and information. They know not only what is strong evidence, but what is complete transparency with that evidence. So we look forward to providing that. And indeed, this is the first batch of information that we are having a chance to review, and it will help us ensure that no delays come, not just with this first potential release of a vaccine, but the future ones as well. And I will remind you that yesterday's important news about the efficacy of the Pfizer vaccine, it still requires Pfizer to complete the appropriate steps to monitor patients in their trials for a long enough period of time. So we aren't done yet. The public saw important, promising information yesterday, but nothing is complete. The vaccine has not been released, and we eagerly await for more information. And California will be ready when we look at that information endorse its safety, to distribute it according to the plans of our drafting guidance groups and the forthcoming community advisory group, who are there to help us communicate effectively with broadly across California the importance and approach to vaccination in our state. So with that, I look forward to seeing you potentially later this week with more of an update on our numbers, more of an update on where the trends are heading, and certainly some additional information about the upcoming weeks where many of us have plans or are eager to make plans to see family, to see people in our communities, and the reminder that we still really endorse and push this concept of doing as much as we can outside, finding ways despite the colder weather to keep it outside, to keep it short, to keep it physically distanced, to wear our mask, and to follow all of these important public health steps that we've seen flatten the curve before and that we will employ and use to do it again. So with that, thank you and have a good rest of your afternoon.